Good evening, everyone. Thank you very much for joining our sixth webinar. It gives us a great pleasure this evening to continue our story of ethics and the importance of ethics in clinical research. In our last webinar, we talked about the foundation of ethics, and we enjoyed the expertise and the knowledge of Prof. Suhail, and we are very happy to have him tonight again to continue the crucial steps that are needed to be done when we think about clinical trials. I'm Bashair Musa, the director of the program, and I belong to College of Medicine, University of Sharjah. As we mention all the time, I think this is one of the very successful initiatives. C.R.E.A.T.E came as a product of a very ambitious collaboration between University of Sharjah and Emirati Diabetes Endocrine Society. Today, I should say, this is the last webinar in the first phase, and we will continue our second phase, inshallah, in January 2026. So we have some instruction as usual, just to make sure that the webinar is going smoothly. It's live streaming in the YouTube channel, the EDES channel, YouTube channel. And if you would like to have the webinar, it is available on demand in the EDES website. Also, if you have any questions, please make sure that you note it down in the chat box, and we will look after it after we finish the presentation. The webinar, and this is very important note, because the webinar is CME accredited. However, for you to get the credits, you have to fill in a evaluation form that you will receive after the webinar. And once you've done that, you will get the credits. Just please stay tuned for the evaluation form that you will receive in your email. Again, it gives me a great pleasure to introduce Prof. Suhail. Another introduction, quick introduction for the people who were not here. Last week, Professor Suhail, he's a consultant in oral medicine at University of Sharjah, former Royal Dental Hospital, Melbourne, holds Clean Dent FRACDS Oral Med graduate diploma in forensic odontology. Also in Australia and in Jordan, he's been certified with both Australian and Jordanian boards. He's the director of Research Ethics Unit and chairman of the Research Ethics Committee at University of Sharjah. He received his bachelor degree in dentistry from University of Jordan and his clinical doctorate from University of Melbourne in Australia. Also, as I mentioned before, he received graduate certificates in research ethics from University of Maryland, Baltimore in the United States. Professor Suhail, he's a fellow of the Royal Australian College of Dental Surgeon in Oral Medicine and holds the Australian Dental Board certificates in oral medicine and general dentistry. He's very active researcher in oral medicine, infection control, legal issues, and he has awarded Australian Federal Police Operation Medal for tsunami victim identification. He's part of several licensing committees in UAE as well as in Canada. He trains Abu Dhabi Police Forensic Dentistry team and expert witness in forensic and criminal cases. Today, for the second week of the second webinar, Prof. Suhail will talk to us about the ethics in action for clinical trials. Thank you very much, Prof. Suhail, for being here again with us. We really appreciate your time and your efforts to be with us. Now the floor is yours.
Okay. Thank you very much, Dr. Bashair. I just need access, please, to share.
Um, yep.
Yes. Um, All right, Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Thank you very much for the very nice introduction, Dr. Bashir. It's a great pleasure to be with you all on this second webinar on the topic of research ethics. And this is a continuation of what we talked about in the previous webinar. We spoke about the foundations of ethical conduct in research, and today there will be more emphasis on the actions that are needed to perform, to make the proper submission, what needs to be shown in the ethical application and the consent, and so on. So hopefully this will help the audience in understand the basic principles of ethics in action, as well as the actual work of the Research Ethics Committee or the Institutional Review Board in reviewing the research. So I first start by making this declaration, which is I have no actual or potential conflict of interest in anything related to this presentation. The overview of this presentation or this webinar will be, we will be recapping on the global research status as a quick introduction for around 5-6 minutes, and then we will move on to the forms of misconduct in research. We will have an example just to show how the imbalance between the progress of science and the protection of human individuals, if there's an imbalance in that, then this will result in serious consequences. Then we will talk about the actions to successfully secure an ethical approval. So based on the UNESCO science report, um, which is issued every 5 years. So the most recent document or recent report shows very interesting findings. And this is, I think, is also witnessed worldwide, witnessed in our own society as well as in our region. The rise in the number of researchers is 3 times higher than the relative increase in world population. So the concept of conducting research in general and medical research in particular is a big interest, and there is a tremendous um, interest in the young generation to conduct research, as shown in that report. There is also an increase in the expenditure on scientific research, which actually outpaces the global economic growth. There is also the developing countries are witnessing the greatest increase in researcher density and in the number of publications. The developing world is still somewhat behind the developed world when it comes to clinical trials. So we can see that there is a tremendous increase, a very significant increase in the conduct of clinical trials worldwide. And then if we look specifically at the clinical trials, the sites of those clinical trials, we will find that 80% of clinical trials continue to be taking place in the United States, the European Union, and in parts of Asia, mainly in China. So those countries they continue to predominate the sites for the clinical trials. However, based on the pattern that we are seeing in the activity of research worldwide, there appears to be a geographical shift towards the developing countries in conducting clinical trials. And we can actually see that statistically. So people who studied the global shift in the clinical trials have seen that actually the Middle Eastern countries are showing a much greater increase in the registration of clinical trials by comparison to North American countries. So North American countries, despite the fact that they continue to be the predominating countries for conducting clinical trials, The annual increase in the registered clinical trials is slowing down at a rate of -5%, while for the Middle Eastern countries, it is increasing, despite the fact that it all represents around 1% of the entire global clinical trials, but the actual increase year after year is around 17%. And when it comes to the global expenditure on research, we find that in a country like the United Arab Emirates, approximately 1% of the gross domestic product is spent on research, on scientific research. This is one third of that spent in the UK, and one half of that spent in the UK, and one third of that in the United States. But globally, the United Arab Emirates is ranked 27th worldwide, which is a remarkable position for a country like the United Arab Emirates. Regionally, we continue to see the Saudi Arabia to have the greater number of clinical trials, followed by the United Arab Emirates. If we compare the number of population and the number of universities and hospitals between the two countries, we can appreciate that the United Arab Emirates is doing very well relatively um, in the issue of the clinical trials. Now, looking at numbers in general, according to the World Health Organization's International Clinical Trial Registry platform, more than 180,000 clinical trials are registered in the United States alone. Approximately one third of that is seen in the Eastern Mediterranean countries, the 21 countries altogether combined. And approximately more than 3,000 clinical trials are registered in the GCC. Among those are 700 clinical trials registered in the UAE. Again, if you take into consideration the number of population, the number of universities, and the number of potential research sites, such as the hospitals that are equipped or interested in conducting clinical trials, we find that it's actually a relatively good number in the United Arab Emirates. So a rapid rise in the research activity increases the risk of the research misconduct. And for that reason, the conduct of research, specifically clinical trials, need to be regulated very carefully, because this is a situation in which a misconduct can result in slowing down the progress of research. It can impact the reputation of the research institute and the researchers, and undermine the integrity and the trust in science in general. And for anyone who is working in clinical research and clinical trials, this is very impactful, because it will reduce the turnover, or reduce the recruitment. And this will obviously impact the success of the clinical trial. For this reason, the United Arab Emirates is one of the countries that actually put down a legal text for to regulate the medical research. So there is the Medical Responsibility Law, which is a federal law issued in 2016, and Article 12, Section 2 of that law states that conducting medical research or experimentation on humans is only allowed after taking the person's consent and obtainment of a written authorization to this regard from the party determined by the executive order, and which comply with the conditions set by this executive order. And the same law also states the penalty for not complying with Article 12. So we see in Section 2, Article 28, that there is a penalty of imprisonment for not less than 6 months, and a fine of not less than 100,000 AED, and not more than 200,000 AED for whoever violates Article 12. So this sort of legalization of research misconduct was necessary, given the increase in the number of research activities, specifically medical research and clinical trials that are taking place, as a first step in order to govern the process of research and to regulate the process of research. If there is a situation of deviation from the ethical conduct of research, then there will be serious consequences. And in order to just orient ourselves into that, I have this short video that I would like you to watch. It will take maybe just over a minute. And it just shows an interaction between a medical doctor and a patient. It's a movie, it's a clip from a movie called Wit. And during that interaction, there is a process of recruitment of one research participant in a clinical trial. And then we'll talk about this following this short movie.
You have cancer. Miss Baring, you have advanced metastatic ovarian cancer.
Go on.
You are a professor, Miss Baring.
Like yourself, Dr. Kalikian.
Ah, yes. Now then, you present with a growth that unfortunately went undetected in stages 1, 2, and 3. Now it is an insidious adenocarcinoma.
Insidious.
Insidious means undetectable at an early stage.
Insidious means treacherous.
Shall I continue?
Oh, by all means.
Good. In invasive epithelial carcinoma, the most effective treatment modality is a chemotherapeutic agent. We are developing an experimental combination of drugs designed for primary site ovarian with a target specificity of stage 3 and beyond administration. Am I going too fast?
No.
You will be hospitalized as an inpatient for treatment each cycle. After the initial 8 cycles, you will have another battery of tests. The antineoplastic will inevitably affect some healthy cells, including those lining the gastrointestinal tract from the lips to the anus and the hair follicles. We will, of course, be relying on your resolve to withstand some of the more pernicious side effects. Miss Baring?
Oh, I beg your pardon.
Do you have any questions so far?
Please go on.
Perhaps some of these terms are new?
No. You're being very thorough.
I make a point of it, and I always emphasize it with my students.
Oh, so do I. Thoroughness, I always tell my students, but they are constitutionally averse to painstaking work.
Yours too.
Oh, it's worse every year.
Well, mine are blind.
Oh, well, mine are deaf.
You just have to hope.
I suppose so.
Where were we, Dr. Barry?
I believe I was being thoroughly diagnosed.
Right. Now, the tumor is spreading very quickly, and this treatment is very aggressive. So far, so good?
Yes.
Better not teach next semester.
Out of the question.
The first week of each cycle, you'll be hospitalized for chemotherapy. The next week, you may feel a little tired. The next 2 weeks will be fine, relatively.
It's 8 months like that.
This treatment is the strongest thing we have to offer you. And as research, it'll make a significant contribution to our knowledge.
Knowledge. Yes.
Here is the informed consent form. Should you agree, you sign there at the bottom. Is there a family member you want me to explain this to?
Oh, that won't be necessary.
Good. The important thing is for you to take the full dose of chemotherapy. There may be times when you'll wish for a lesser dose due to the side effects, but we've got to go full force. Dr. Barry,
Yes.
you must be very tough. Do you think you could be very tough?
You needn't worry.
Good. Excellent.
I should have asked more questions, because I knew there was going to be a test. Hi, how are you feeling today?
Fine.
Great. That's just great.
All right, so this short clip from the movie Wit represents a situation of an imbalance between the desire for the advancement of science that is, expressed by the doctor who is conducting the clinical trial, and the protection of humans, which is demonstrated by the patient who was just recently diagnosed and has been recruited very quickly in a clinical trial related to a chemotherapeutic agent. So this imbalance obviously has resulted in some sort of regret by the research subject after the inclusion in the clinical trial. And of course, in real life, people are going to drop out from the clinical trial, or they will be non-compliant throughout the clinical trial, which really affects the quality of the clinical trial and delays the outcome or the results of that clinical trial. And that's the problem. If the process of the recruitment and the process of the consent obtainment was done correctly from the beginning, then the retention of the research subjects is going to be prolonged until the end of the clinical trial, and this will result obviously in the reliable and significant and quality outcomes. And situations like this are exactly the purpose why the Research Ethics Committee exists. It is to look into the protocol, look into the recruitment sheet or the invitation, look at the consent, the participant information sheet, look at the setting of invitation, who's going to perform the invitation, who's going to get the consent of the potential research participants, and then advise the researcher on all of those elements in order to enhance the quality of that research from an ethical perspective. When this imbalance did not take place, such as the study that took place on syphilis patients in Tuskegee County in the United States for over 40 years. Persons with syphilis were observed for 40 years without being offered any treatment. If you look at the timeline, this is one of the longest observational studies that are there. So if we look at the timeline, we see that in 1932, the study started, and it only stopped in 1972 after 40 years. During the conduct of that observational study, penicillin was discovered, and when penicillin was discovered, it was found to be very effective and a very safe drug to be used for syphilis patients. It would eradicate the Treponema pallidum in those patients. However, despite that, the researchers actually prevented the penicillin from being delivered in the health centers in Tuskegee in order not to interfere with their longitudinal observational study. And there were a number of publications discussing this longitudinal observational study related to syphilis as an untreated infection. And they reported all of what we know today in terms of the clinical manifestations of primary syphilis, the duration of the latency, how many percentage of people will develop secondary syphilis, how many will develop the tertiary syphilis, the bouncing of secondary and latency before they go over to the tertiary syphilis, and so on. And this continued until an article was published in the New York Times that talked about this situation and discussed this situation as an unethical practice because the doctors who are government doctors were taking advantage of the poorly educated syphilis infected persons and deprive them from the medication in order for them to achieve great scientific results or medical results related to the progression of syphilis. And if we look at the invitation document, which is located right here, this is the original one, and this one is actually, I wrote it in order to just to clarify the words. You will find that there is a tremendous amount of deception and misleading statements that are in the invitation sheet that was distributed to the people there. And if you look at the consent itself, the consent document also lacked a number of important details. So there were issues with this study, such as the consent has misleading and lacks essential information. The invitation was repeatedly suggesting treatment rather than research study, and there was an exploitation of marginalized group instead of recruiting all people in a just and in a fair way. As a result, and after years decades after the start of this observational study, the study obviously was discontinued and was stopped. And then years after that, in 1997, the President of the United States offered the public apology for the victims of that study. So the reason why this is shown is that the interest of the medical team, who are medical doctors, infectious disease specialists, and so on, the interest in order to find out what happens with those individuals if they are left untreated was not balanced with the protection of those individuals. As a result, there was mistrust in the conduct of those government doctors. There was a mistrust in the medical research itself and the science itself, to the extent that the leader of that country needed to provide an apology in order to correct this misconduct. So when we talk about the ethical conduct of research, we're not referring to a situation of novelty. We're talking about a situation of enhancement of the recruitment and retention of subjects in the clinical research. Now, looking into the actions that people or researchers need to take into consideration in order to secure an ethical approval, and what sort of ethical needs need to be addressed before they make the submission. The first thing you need to know is whether the study that you are conducting requires an ethical approval. So if the study involves humans, human tissues, or human samples, or privileged human data, including the archived data, even if they are de-identified or anonymous data, this will require an ethical approval from the Research Ethics Committee. The study consisting of data collection that is systematic, pre-planned, and which adopts a research methodology. That's another condition in which we define an activity as research, and studies that would produce results in any form of scientific publications. There are studies that do not involve humans whatsoever or human tissues, such as studies on microbiology or institutional research or clinical audits inside an institute. It is not pre-planned. It is not planned in order to achieve some form of publication. There is no clear methodology or no established scientific methodology that is being followed. There's only a question that needs to be answered for administrative or institutional purposes, or satisfaction surveys. Those do not need an ethical approval. If you are doing a study similar to those, like a satisfaction survey or an institutional survey or clinical research, but you have the intention of publishing it later on, then it's a good idea to get the ethical approval anyway, even if your initial intentions are for a clinical audit. But just apply for an ethical approval, because eventually the journal is going to ask you for this. Research ethics review depends on two broad, big aspects. One is the research methodology, and two is the sample vulnerability. Now, when we look at the research methodology, we're looking at what sort of methodology that is being followed by the researcher. This is in order to determine the level of review. Can this be reviewed by the chair of the committee and get the approval immediately, or does it need the entire committee to meet and to look at the document and to have a consensus on the final decision? So research methodology can be qualitative or quantitative, observational studies or experimental studies. Obviously, the purpose here to analyze the methodology that the researcher is describing in their application form is to assess the risk on participants. Now, please remember, it is not only the participants that can be at risk. Sometimes there is risk to community and community values in situations of surveys or questionnaires or epidemiological studies, and those need to be also looked into as some form of potential risk. We also look into the sample vulnerability. So we look whether or not the researcher has selected a specific sample that can easily be exploited, or whether this sample is not really competent, cognitively competent to understand that research and to give the approval. Of course, the purpose is to assess the person's ability to understand their participation and their freedom to consent or to decline that participation. By looking at the research methodology and the vulnerability of the sample, we can determine whether this study can be approved by the chair or needs the full approval. Of course, we have the category of incomplete, when the study doesn't have the complete documents or the researcher submitted their application for ethical review, but there is no clarity in the research methodology or in the sampling or in the sample population or the sample size even. So we return it back in order to have more clarification from the principal investigator in order for us to help us how to, the level of review or how to proceed with this application. Applications that are approved by the chair are usually low-risk methodology, such as an observational study, a retrospective analysis of some anonymous data, and a non-vulnerable population, on a non-vulnerable population. However, if the study has a high-risk methodology, such as an interventional experimental study, with or without a vulnerable population, such as children or elderly or debilitated patients in hospitals, those are vulnerable population undertaking a study that is of high risk because it's an interventional, then it needs to be reviewed by the entire committee. So for this reason, there are studies that are expedited in the review and studies that are delayed in the review because of the assessment of the risk level and the vulnerability of the sample. So tips to successfully secure an ethical approval. Number one, submit your application only after it becomes ready. Don't submit an application that is a draft, because this will be returned and there will be further delay. You have your ideas ready, the methodology is well established, the documents are ready, you make the submission in a complete format. Second, there are always risks in clinical research. So we expect the researcher to acknowledge that risk and to acknowledge those risks and to put efforts to minimize them. So if there's a clinical study, which there is let's say a clinical trial in which a drug is being tested, even if it is a phase 4 post-marketing clinical trial, and the drug is already licensed, the testing of that drug in those circumstances under the research umbrella rather than the medical care means that there are risks. When you are the researcher, you are the principal investigator, acknowledge those risks in your application form and make measures to minimize those risks as much as possible. The third item is describe the vulnerability of your sample. Avoid including vulnerable groups if their involvement is not necessary. Let's say that your medicine is a drug related to reduction or control of the diabetes. So obviously you need people who are diabetic in order to test the success of that drug. This is just a hypothetical example. However, there are vulnerable population. There are the children with diabetes, and there are the elderly with diabetes. There are people who are cognitively impaired and have diabetes. So try to avoid those vulnerable populations in order to have your sample all in the category of non-vulnerable population, and in order to get the ethical approval as quickly as possible. The informed consent is one of the essential and very important documents that need to be submitted. Brief information in the informed consent, as you can see in this cartoon, is really is a good reason for rejecting the study. So those applications, you need to take into consideration that every time we do a clinical study, we have two documents. We have the participant information sheet. And this participant information sheet is the document that needs to be retained with the participant. The participant will take it home, will read it, will think about it, will maybe discuss the participation in this research with a relative, with the spouse, with the children, with other colleagues, other family members, before they decide to accept or decline. The informed consent is a document that is signed and returned to the principal investigator. So after the participant reads the content of that research and fully understands their involvement in that research, they will then sign the consent. Don't mix them up. Don't put them in one document because they need to be addressed as two documents. What we have seen in the short movie that I showed you is a situation in which the recruitment was wrong, as well as the signing of the research participant on the consent was immediate. She wasn't given time to read the document. She wasn't even given the document itself. So this is a situation in which there is a deficiency in the information that is given to the participants. So tips to successfully secure an ethical approval with regards to the participant information sheet and consent. Make sure when you make the submission that the informed consent and or the PIS or the participant information sheet are complete. They have the full information that is needed. Nothing is deficient. Nothing is suppressed. Please remember here something. In many instances, we have a researcher who says, I will just give a brief document, but then I will explain, or I will be available for the research participants to answer any of their questions. The recruitment and the consent, the obtainment of the consent from research participants should not be passive. The delivery of the information should not be passive. So you wait for the potential research participant to ask you questions, and then you are ready to give the answers. That doesn't work. That is a deficiency in the consent process. What needs to be done is full information given to the participant, ample time given to the participant to read that information and to comprehend. And when they fully understand and comprehend their research participation, they can then accept to participate in that research. The informed consent or the PIS are in the patient's native language. Now, this is another situation which we face frequently. If the participants are of certain nationality or the common language that is understood by the majority of the sample will be an Arabic language, then the participant information sheet and the consent should be in Arabic language. If the majority of the people are in English, we ask for both languages, Arabic and English. If the research involves the expatriate workers in the UAE, for example, who come from Southeast Asia or come from the Indian subcontinent, then the documents, the consent and the PIS should be in their own native language. And it is the responsibility of the researcher to make the proper translation, the formal translation, in order for the information to be delivered accurately and fully. Risks should be sufficiently addressed in the PIS and in the consent. Contact details of a third party for complaints. And this is a common deficiency that we see in the PIS, in which they don't add a contact details of the third party. In our case, in the University of Sharjah, it is the Research Ethics Committee. Wherever you are, you find out who's going to approve that study, and you should write down the contact details of the authority that approved that study in the PIS, so that the participant who has the sheet of information and will take it home, if there's any incident, they have a contact number to call. This is an example, although it is not a clinical study, but this is an example of a number of deficiencies that we observe in the consent form. The first thing is that it is a consent form without the PIS. It is an immediate consent without giving the participant sufficient information for them to take home. You don't take it back. You don't get the name and the signature. The second is it involves school children who are underage. So the PIS or the document should be addressed to the parents and not to the student. The first statement right here, I'll just highlight it here, is dear student. It should be dear parent, dear father, dear mother, etc., because you should be addressing the legally authorized representative. Again, the statement of doctors here and there can actually have an impact because it will give the impression that this is a medical procedure or a medical questionnaire that is necessary for my own health, for my own well-being, and that can be problematic. We have the issue of the incentives. So any incentive that is related to research participation should be as minimum as possible in order for those teenagers or students not to participate in that research purely for the incentive. The statement that there are no risks are also questionable, and the statement of the risk itself among teenagers that we want to ask you questions about your own smoking habits. It's as if there is a normalization or acclimatization of the smoking among those individuals. So again, for this is some literature review. So this is a systematic review of 14 studies in order to find out whether people actually comprehend the content of the consent who participate in clinical trials. And what they found is that there is a poor understanding, or poor comprehension of the concept of the placebo. The sample randomization is poorly understood by the majority of those individuals, the risk associated with that research, safety, and side effects. Another study that was related to the endocrinology, close as possible to the audience of this webinar, in which in Korea they surveyed 140 patients and 151 healthy volunteers. Both groups were participating in a clinical trial. And those patients were significantly influenced by the medical personnel regarding the participation. More than 50 of the patient population, those are the people who have the disease and they were participating in the clinical trial, misunderstood this as a clinical trial and assumed that all individuals will receive the new drug. And this is serious. It means that people's comprehension of the participant information sheet or the consent is defective. They don't understand what is the placebo. They don't understand what is the clinical trial, although they are already involved in it. So there were a number of measures in order to enhance the quality of the consent, maybe by adding, whenever possible, by visually aided images or diagrams or sketches in order to enhance the participant information sheet for participants to understand that they are actually involved in a process of a clinical study. This is an invitation, for example, one of my own research studies in which this is the invitation to participate, not the participant information sheet, but despite the fact that I'm not dealing with vulnerable population, but I actually use those types of images or sketches in order to make sure that the study sample understand exactly what are their involvement in that research would be. If there is a significant amount of text and the text is very technical, high quality language terminology or medical terminology, people will probably not understand, and this will result in their later misunderstanding of their involvement. But there is some form of visual aid to the participant information sheet, then that would definitely help. We spoke about in the previous webinar about the therapeutic misconception. Just a quick recap. It is misconceiving research as medical care. It's actually quite common in clinical trials, as research has shown. Why? Because in the participant information sheet and the consent, there are some references to indicate that this is medical care rather than research. For example, the researcher is using doctors and nurses instead of researchers. They're using drugs or medications instead of using experimental drugs. Always make reference to the experimentation and the research repeatedly. Use research procedures and research steps instead of using simply blood tests and so on. Emphasize the issue that there is some sponsorship from the pharma, there is some sponsorship as a research grant from the institute, all of which will reduce the likelihood of um, therapeutic misconception, like I said, which is a common phenomenon in clinical trials. So in this webinar, we've looked at the global research status, and we have shown how there is a global geographical shift of the clinical trials and research in general towards the developing countries. We looked into the impact of misconduct in research, and we had some actions and tips to successfully secure an ethical approval. And with that, I finish my webinar, and I thank you very much for attending and for being in this webinar. Thank you.
Thank you very much, Professor Hale. Very informative, very well structured presentation. And again, I like the Arabic part of it. It is very, very enjoyable. We're waiting for people to ask questions, but maybe while we are waiting for them, I would like to start by a very relevant question. Many of the people who are joining the webinars, they are young researchers or young medical students. So, like the access of research for them while they are in the hospital, or the most practical one, is like case reporting. One case or series of cases. So if there is a person working as a clinician in any of the hospital, and they found this very kind of interesting or unique case, what sort of ethics they need to bear in mind while they dealing with that case? It is on medical record, not an actual patient case. Yes.
So, according to the global understanding of research ethics, this is not research. So, all they need is the consent of the participant. And this is actually, if they look at the journal, the author guidelines in the journals, they will state this. So, they need the patient's consent to use the data, or to use clinical images, or to use radiographs, those sort of things. If there is any identifying information, such as a facial picture, then they will definitely need to get the written consent, explicitly explaining that there will be an identifying information in the publication. But they don't need to get the approval from the Research Ethics Committee
All
for
right.
case and case series.
Okay, but if it is for, like a large number of medical records that will be assessed, and some sort of research question will be involved in there, then they need the ethical approval for that.
Yes, exactly. So if the case report or the case series changed into an observational study, and there is a systematic collection of data, then they will need the ethical approval.
Yeah, sure. So now we receive a question, a comment and question, thanking you very much for a very valuable and informative presentation. And they say that should we need to give the potential participant the information sheet in a separate visit from the signing of the consent form? So do the researcher needs to invite the participant twice, two different visits? In one, give the information, and in the other one, ask them to sign? Is this how it should be?
Yeah, depending on the research. So usually in case of, let's say in cases of questionnaires, whether they are online questionnaire or paper questionnaire, then they do it once. And in that case, they don't need the consent. They don't need a signed consent. So let's say I'm doing an online questionnaire, I send the link. The participant information sheet will be in my invitation email or invitation message. The participant information sheet will be the first page on the questionnaire, And then once they enter the questionnaire and then they submit the questionnaire, this is called an implied consent. They don't need to sign anything. If it's a
Mm-hmm.
clinical study, an interventional study and experimentation, then they would need to be invited to that research, given the participant information sheet, and then given the opportunity, not necessarily dismissed for a second opinion, a second appointment, but they are given the opportunity whether they would like to think about it or whether they are interested in participation. And if they are interested in participation, then they will sign the consent on the same day. If they say, I'll think about it, I'll discuss it with others, they should be given that opportunity and come back and sign the consent whenever they are ready.
Sure. We receive another question about the submission to an ethical committee. They say that do they need to submit the pictures of the devices that will be used, like ECG, for example, if the study involve, conducting this sort of assessment, do they need to kind of take a picture of that device and submit it to the committee?
Yes, thank you. So, with regards to equipment or machines and so on, it really depends on the actual involvement or actual interaction between this machine and the human being, right, and the human participant. So, in case of the ECG or the EEG, nobody is going to care about the shape of the machine, but participants are going to be interested in knowing how will this be applied to them. So in case
Mm,
of the ECG, it is important to make the research participant know that we're going to put the electrodes on those locations. This is important because obviously there will be unclothing of the participants, and participants need to understand before they get into that research that part of my body is going to be unclothed. The nurse or the research assistant is going to apply the electrodes on those locations. And no matter how well you write it down as text, one
mm,
picture or one sketch of the electrodes being applied on the chest and the arms and the legs would be enough for the participant to know exactly that this is going to happen to me if I participate in that research. And again, some people look at this as a deterring request, but it is not. Actually, what you want is people coming to you and understanding what their research involvement will be like and
mm,
accepting this. Those are
mm.
the individuals who will last, who will stay with you throughout the entire research and who will appreciate your research and will be the reason for the success of that research. So not the machine, but the actual interaction of that machine on the human body.
Yeah, sure. And here I have a question not related to the research consent, it's related to the medical consent. Somebody asking about the medical consent that we usually receive in the hospital. Do we need to consider it as the research consent? We have to read it carefully before we sign it and understand it and all of that?
For the consent for admission, let's say,
Yeah,
to the
yeah, yeah.
hospital.
Hospital admission, yes, the medical consent.
It's not a common practice. I think people sign it. People
Mm,
have the right to have a copy,
mm,
um, but reading it and discussing it you have to look into the administration of the hospital, what they're expecting, if there's an accreditation body that has some demands in this regard. But again, anybody who walks into the hospital to be admitted, let's say for surgery, they have the intention to walk into that building for the surgery.
mm,
Research is a different thing. Research is an voluntary participation in research. For that
mm,
reason, the consent taking in research needs to have a greater emphasis because that's not the intention of the patient. But
mm,
for patients who are referred to the hospital, admitted to the hospital, they are expecting that they will be inside the hospital, receive care, nurses, etc. So that general consent for the admission to the hospital is a different story.
mm.
For research, it needs more details because it's a different pathway for the patient.
Yeah, sure. We have here a question. Maybe it is we kind of covered it last time, but somebody asking about there is any national manual that describing all the guidelines for conducting clinical trials in UAE?
Um, I'm not aware of manual for clinical trials per se. Maybe for our colleagues in the health authority, whether it is Sharjah Health Authority or Dubai or Department of Health in Abu Dhabi, maybe they will be able to help us with that. So I am sure that there are some policies and some procedures, but an actual manual how to conduct clinical trial, I'm not sure. But there are policies regulating the clinical trials in all health authorities.
Yeah, and I think it is a person needs to find out where the right ethical committee to approach because there is some sort of variation when it comes to the guidelines. There is a question here you already answered, but I think the person here wants a confirmation. Somebody asking about the observation prospective studies that involve collection of routine clinical practice. For example, ECG for diabetic patient or CKD patients. Do you need the consent form for that?
So that's an interesting question. I think it's one of the issues that need to be discussed by the Research Ethics Committee because here the worry is that the collection of the data is not passive, which means the data is there anyway, and I am just collecting it for my research. Uh, the worry here is that the researcher will intentionally subject those patients to the ECG or the EEG or certain blood tests that are not part of their medical care, only for the sake of research. So if the situation is the latter, which is the researcher is actually requesting certain blood tests or certain procedures in order to generate data that will be used prospectively for those patients, then definitely they need consent for those individuals because it is outside the routine medical care. If those tests and those procedures are part of their routine medical care, and we know that they will be done anyway, whether there is research or not, and they will be stored in the patient file, regardless whether there is research or not, then they don't need a consent from the patient because they're done for medical care. After 2-3 years, there has been some good amount of data. Then the researcher will get the ethical approval to retrospectively utilize that data and analyze it. But
Okay.
if it needs to be discussed at the level of the research ethics.
Yeah, sure. So moving a little bit from there, when we have multi-center study or multi-site study, if it is within the country, it is easy. You get the approval from each entity. But for example, if you're collaborating with people outside the country, and they do have, like one of the sites are in UAE, another site in a different country. So just having the ethical approval from that country by that group it would be more than enough, right? To be considered for publication.
So depending on the collaboration, if the collaboration from us from the UAE involves anything beyond the intellectual collaboration, so it involves analyzing the tissues in our labs, adding as an additional site, we have additional patients from here, adding to the pool of patients, then they will need the ethical approval. But if it is only an intellectual contribution that the research is done another country, recruitment of patients is in another country, analysis of the samples are there, then we don't need an ethical approval from here.
All right. So I think this is would be the last question. We asked already a lot of question, and the question actually is not very clear. The person asking what consent needs to be, does the genetic counselor need to ask for? I'm not sure what they mean exactly, but maybe somebody who's dealing with genetics. Maybe it is very short question. It's not very clear, but maybe if somebody working in a hospital with some sort of genetic profiling, for example. So they need a consent from the patients who got the analysis of this group of genes, for example? I'm
Yeah.
just trying to make it easier to answer.
I think it depends if the genetic profiling was done specifically for the medical care or the interest of those individuals, then it has been done for them. They need the ethical approval because they will be retrospectively reviewing those profiles and making some correlations with the phenotype and so on. But if it is collected prospectively, so people who are included in that research, I'm sorry, people who are admitted to the hospital, they are given invited to participate in a genetic profiling. They definitely need the ethical approval and the consent. So I think in many situations in which we do research that is retrospective, the Research Ethics Committee looks into the concept of the waiver of consent, which means that collecting the consent from those individuals would be impractical because the number is too big, or the retrospective, the historical return of, returning back to those individuals historically will be, quite impractical. So they request a waiver of consent. So if it is a prospective study, there is no justification for not getting the consent. It's a retrospective study and the samples were collected for medical care, but now they are stored and they are available for a future study. And the obtainment of the consent is proven to be impractical. Then the Research Ethics Committee would consider the waiver of consent. التنازل عن الموافقة. Do the research as an anonymous research without having to go back to the individuals to get the consent.
Yeah, sure. So thank you very much. That was very clear. Thank you very much, Prof. Suhail. It was really great pleasure to have you twice, and we believe in the importance of the topic. That's why we have you twice. We just finished the first phase of C.R.E.A.T.E webinars, which is overview of the whole process of research. And in the future, we'll be having more kind of focused discussion, and it would be great to have you again. Thank you very much for investing your time with us, and wishing you all the best, and wishing you a happy new year.
Thank you very much. Same to
Thank
you.
you.
Thank you.
Thank
Thank
you.
you. Assalamu alaikum.
Wa alaikum salam. So, as we mentioned before, please, this is the sixth webinar. Make sure that you have your credits by filling the evaluation form that you will receive in your email. So stay tuned for that, please. And we do have a very successful master program. And Prof. Suhail, by the way, he's one of our faculty in the program. It is a program that has several arms, and one of the main arms of this program is research. So if you are interested in research, if you want to make difference in the diabetes journey, please check our website, the program details and the registration details in here. Also, it is very important to know that the society running other important initiative, one of them with collaboration with the American Diabetes Association. And the next and the final webinar will be in the 15th of December. Again, we do have here the QR for you to scan. And also, we do have our Making Diabetes Technology Work continuing education program that have about 3.5 credits. Again, it's very important program. Here is just the QR if you want to register. And finally, we do have the EDIC of 2026, very important and prestigious meeting. I hope that we will see all of you there. And please, if you liked our webinars, C.R.E.A.T.E webinar, stay with us. Stay tuned for the announcement. We will be coming back with more webinars in 2026, inshallah. And thank you very much again for everyone who attended today, and for everyone who registered and couldn't make it. Wishing you a great new year, and we'll see you in 2026. Have a great night, and see you.